Our next speaker is Chuck Bogosta, who's Executive Vice President of UPMC, President of UPMC International Services and the UPMC Cancer Centre, and I might add, a good friend of Bon Secours, and indeed is partnering with us in our plans to provide radiotherapy services from our hospital in Cork. As Executive Vice President of UPMC and President of UPMC International Services, Chuck oversees collaborations that provide UPMC's world-class medical care, technology and services to health systems, hospitals, doctors and patients around the world. These partnerships and clinical initiatives span nearly a dozen countries and feature collaborations ranging from remote pathology consultations to oncology hospital construction. International projects in Chuck's portfolio include a leading transplant hospital in Palermo, Italy, the development of a new biomedical research centre in Sicily, and also advanced cancer treatment centres in Italy and here in Ireland. Chuck earned a Bachelor of Science in Business Economics from the State University of New York and a Master of Arts in Educational Administration from Bowling Green University. Chuck will speak to us today on partnering for success.
Good morning. Thank you for that introduction, Peter, and Bill, thank you for inviting me to be here today, and it's an honor to share this podium with Ambassador O'Malley as well, so I appreciate this opportunity. I think every American likes to first get up when they talk to folks in Ireland and tell them about their connection to Ireland. Mine is I married Marianne McGinn, and Marianne McGinn said to me, I'm willing to take your lousy last name, Chuck, if you go with Irish first names for our kids. So we have a Sean, we have a Brendan, we have a Caitlin, and we have a Ryan. So I'm proud to have that kind of Irish heritage. So this part of my presentation was to formally announce the partnership between Bon Secours and UPMC in the development of a radiation oncology center in Cork. Well, since the cat is out of the bag, between the ambassador's talk and Peter's talk, I thought I'd actually start with that. I'm not sure I can get to that slide easily because I haven't used the technology up here yet, but I will say that I am very, very proud to announce the fact that Bon Secours and UPMC will be bringing advanced radiotherapy to Cork together. We've formed a joint venture. It will be a joint venture where we're both capitalizing the project. UPMC will take a management role, and we will be working together over the next 2 years to bring advanced radiotherapy to that part of Ireland. So we're very proud to expand our presence here in Ireland. And in fact, many people have come up to me recently and said, we thought you left Ireland. I think most people in this room know we had a relationship with the Beacon Hospital, but we actually never left. We've been in Waterford for 10 years now, and we're very proud of what we've been able to accomplish there, and I'll talk a little bit more about that in a minute. So moving into the real topic of today, which is to talk about partnerships and what that really means to us and what it means to us in terms of what we believe we've been able to bring in value to Ireland and in the future with our relationship with Bon Secours. So starting with just the definition of partnerships, I will apologize in advance here. The font on my presentation is rather small for the most part, so I'm not going to be going over in detail any of the slides that are on here. And I do believe on a memory stick you actually have a copy of this presentation, so I won't go into detail on it. But this is what partnerships are all about, and it really, in particular, applies to the relationship that we're developing with Bon Secours, essentially starting with mutual trust. What's fundamental to everything we do, and what we've heard already this morning, is that patients come first. So to give you a little bit of history about UPMC, our history does go back to the late 1800s. If you fast forward to today, we're now the largest integrated healthcare system in the United States. We have a health insurance company that has 3.1 million members. We have a health services division that just expanded to 25 hospitals in the United States. We have 62,000 employees. We employ approximately 4,000 physicians. And we have an international division that has a presence in approximately 12 countries around the world. And so I wanted to focus a little bit upon that partnership model that we have, and a little bit in contrast to what the Mayo Clinic is doing. And I actually think it's great that the Mayo Clinic is here because in many ways we've aspired to what the Mayo Clinic has done in the United States. They've been very successful in their model in transporting a culture to other parts of the United States. What we decided was that we wanted to work on developing partnerships overseas and transferring our culture and somehow, in some way, integrate that culture into overseas types of partnerships. So we've become the largest integrated healthcare system in the United States, and what that really means is that we have both the front door and the back door. The front door being the health insurance product, and the back door being the provider system. So I actually just did the introduction to UPMC International. Our key message here is, and it's very similar to the Mayo Clinic of keeping patients close to home. We believe everyone, and we practice this every day, everyone should have access to high quality health care as close to home as possible. We do it a little bit differently, though. We actually place teams on the ground, and we actually are part of the patient care delivery process, and we're actually working very closely, and as I'll demonstrate here with their Whitfield Clinic relationship that we have in Waterford, that we actually are on the ground and actually working side by side with our partners. This is where we're located today. We're very careful about where we go. We do have a pretty broad portfolio of international relationships, and they vary. And the way they vary is under these four models. The first model would be a wholly owned type of model. In Ireland, or in Italy, for example, we actually own the cancer center in Rome, and then we have joint ventures. An example of that would be the joint venture that we have at the Whitfield Clinic in Waterford. We also have a joint venture with the Italian government in Sicily in a transplant hospital. We have a joint venture in Kazakhstan in the development of a cancer strategy for their entire country, just as an example. We also have management services agreements where we actually are hired simply just to manage an operation, but we don't make an equity investment. And the last is our advisory services, which are more of a consulting type of model. So those are the typical ways in which we do model. We also have telemedicine capabilities. We are also capable of certainly providing services to patients in the United States who would like to travel there, but that's not our priority. Our priority, number one, is to ensure that patients do not have to leave their country or their region for access to care. So what are we doing in Ireland? As I mentioned earlier, we were in Dublin at one point, and that was with our beacon operations. But today we're in Waterford with the JV for the Whitfield Clinic, and as I mentioned earlier, we will be in Cork very soon. So what did we do in Whitfield? And this is a good example of how I think partnering has really brought value to a part of Ireland and a part of the world that did not have access to a certain amount of care. About 10 years ago, actually it would probably be 11 years ago now, Bertie Ahern, the Taoiseach at that time, was driving to Waterford, and he was met in Waterford by a protest, and it was a protest of people who were, and I'm sure everybody here knows this story, but it was a protest of people that were throwing tulips at him. And the protest was all about bringing radiotherapy to Waterford. So what we did was we met with a group in Waterford to develop a radiotherapy center so that we could bring that service to Waterford. Up to that point, patients had to travel 2.5 hours to Dublin in order to obtain care. We met with, at that time, the Minister of Health, Mary Harney, and she basically blessed the project. She asked us how long it would take to get it done. We said it would take 2 years. She leaned over to her finance director at the time and said to him, how long do you think it would take us to do it? And he said about 8 to 10 years. So she said, you guys can go ahead and do this. So that's how it all started. And we're proud to say 2 years later, we brought not only radiotherapy to Waterford, but the first PET-CT in the country to Waterford as well. And so today, it's a great example of how we brought a vision into reality, and we're just very proud of what we've been able to. And it's a great example of doing something that, first and foremost, patients were first. It's also a place where we've been able to treat both public and private patients. So that's what happened there. So moving on to a whole nother area. As we started our discussion with Bon Secours about a year ago, actually it's been less than a year at this point, one of the things we realized, and it was thanks to some of the guidance by Noel Daly, was that concussion treatment was becoming an issue of discussion, at least, in Ireland. And just coincidentally, UPMC has is widely regarded as having the best concussion treatment program in the United States. And we had just concluded a symposium with Ambassador Rooney's football team. I'm not sure I'm supposed to put Ambassador Rooney and his football team in the same sentence. But anyway, Ambassador Rooney's football team, the Pittsburgh Steelers, and ourselves in developing a symposium that was focused on providing education to coaches and to athletes and parents and all the constituents that would be impacted by concussions. And so we hosted that symposium with the Steelers, and it was a huge success, and it really advanced the discussion about concussion. So as I said, coincidentally, we were in the process of doing that, and I was in a conversation with Bill Maher, and I was telling him about this, and he said, well, we should do the same thing. And so we ended up partnering with the GAA, and about 3 weeks ago, we actually hosted this symposium, which is the first national symposium on concussion treatment. And it was wildly successful, and I think what it did was it brought the level of dialogue and discussion on concussions up to a level where it really needs to be so that it's much more front of mind. And for me, it was particularly interesting, somewhat entertaining, to watch the rugby advocates in the room and the GAA advocates in the room talk about their own philosophies about concussions, and it was mostly about time on the field. Should it be 20 minutes, allow them to be out there 20 minutes, 30 minutes, 10 minutes, should we allow them to be out there at all? And for those that were at the meeting, you'll know that there was a pretty heated conversation, actually, but it was really helpful to actually raise, I think, the dialogue and the focus on it. And so we really do hope that we can take this. This is a great example, again, of a partnering with Bon Secours, that we can really take a topic in Ireland that needs attention and really bring more attention to it, and essentially, in the end, be able to provide a higher level service to patients and athletes who actually require concussion services. So, as I mentioned, it was a huge success, and we, again, hope to do more things like this. This is the beginning of what we believe with Bon Secours, which will be hopefully a very, very long-term relationship. 100 years is what we keep talking about, and we do have ideas for other areas, which I won't talk about today. And I've already talked about this at the beginning because it was already disclosed, but this is what we'll be doing in Cork. And again, we're very proud of that. And I want to thank everybody for listening to our story, and I appreciate being invited to this conference. Thank you.